we are aware of this genetic variant, I think reported in about 1,000 individuals in England, and the authorities in the UK and under Matt Hancock's leadership obviously are looking at the significance of this. We've seen many variants, as we've always said here, this virus evolves and changes over time, and we've seen different variants emerge.
The World Health Organization has reported that there is a new strain of virus different from the SARS-CoV-2 that causes coronavirus disease 2019. The variant was originally discovered in the United Kingdom and was first identified in a person who reported no travel history. A similar mutation was also reported from South Africa and countries like the Netherlands and Denmark. Scientists have identified 3 major mutations of the COVID-19 virus so far: D614G, amino acid 614 on spike protein, VUI 2020-1201, N501Y. D614G was responsible for the fast spread of the virus in Europe, the US, and the rest of the world. The other 2, VUI 2020-1201 and N501Y, are the current one causing panic in the UK, but there is also what is called the South African drift, in which 3 mutations happened in the genetic makeup of the virus.
The variants were first detected from a blood sample collected in September this year in UK, and the test was eventually carried out in October. And it was then that it was established that there is a new variant. And evidences have shown that the same variant has spread and is the major cause of COVID-19 in UK and neighboring countries like France, and it has spread to other nations like Canada, Australia.
While the variant appears to be more contagious, health experts and researchers have said it does not seem to be any deadlier, and there is no evidence current coronavirus vaccines should be less effective. But the yet-to-be peer-reviewed study estimated the strain is 56% more transmissible.
This virus has been mutating, so there's genomic surveillance, going on since we had since the scientific world came to know COVID-19. But there's been what we call genomic surveillance. So genomic surveillance is going on. We're trying to see how fast the virus mutates. Now we have a variant that has been found in the UK, in South Africa, and now in Nigeria. But it remains to be seen whether the variant in Nigeria is responsible for the increase in the number of cases that we're witnessing now. What it means is that we need to take more samples, because we just the facility where that was done just on a few samples. We would need to do genomic surveillance on many more samples to find out whether that is true or not.
It's more readily transmissible than all others, but there is no clinical evidence of increased severity or lower severity or virulence. The only thing that is established is the fact that it is more readily transmissible.
Despite the new COVID-19 mutant triggering fresh global panic with nations reimposing travel bans, scientists say it is too early to predict the virus is going to cause a second wave or make recently developed vaccines ineffective.
The available vaccines, the mechanism of action presently as a result of investigations are not actually altered. There is what we call virus escape. There is no established virus escape from the available vaccines and even the therapeutic medications that are available. So we cannot say the mutation or the new variant can actually render the vaccines useless.
There is a lot of hope, especially with the advent of the vaccines that have been announced in the last few weeks. And from WHO side, we are sure that we can defeat this pandemic using the existing tools and also the vaccines.
The new and potentially more contagious strain could lead to more cases and strain the already heavily burdened healthcare systems. However, the populace need to be more safety conscious and follow all safety measures against COVID-19. The best form of protection recommended by experts include strict adherence to non-pharmaceutical measures such as regular hand washing or use of alcohol-based sanitizers, wear a mask, and observe physical distancing at all times.